understanding space. Breathe deeply and know that lasting change takes time. Today we're discussing how to reduce pore congestion over time. Not overnight quick fixes, but sustainable practices that gradually clear your pores and keep them healthy. Pore congestion, those visible dark spots, rough texture, and feeling that your pores are filled with something, is incredibly common and frustrating. But here's the truth. Clear pores aren't achieved through one miracle product or aggressive treatment. They're the result of consistent patient care over weeks and months. Understanding pore congestion helps you address it effectively. Pores become congested when they fill with oil, dead skin cells, and debris. This mixture, when exposed to air, oxidizes and darkens, creating visible spots. Unlike active acne, congested pores may not be inflamed or painful. They're just clogged and visible. Some people are simply more prone to pore congestion due to genetics, oilier skin type, or larger pore size. You cannot change your pore size. That's determined by genetics. But you can keep pores clear regardless of their size. The long-term approach to reducing pore congestion combines regular exfoliation, oil control, thorough cleansing, and lifestyle factors. Let's explore each. Regular chemical exfoliation is the cornerstone of managing pore congestion. Chemical exfoliants dissolve the dead skin cells and debris that clog pores, working more effectively and gently than physical scrubs. Salicylic acid, BHA, is particularly effective because it's oil-soluble and penetrates into pores. Use a product with 0.5 to 2% salicylic acid 3 to 4 times per week. This could be a toner, serum, or leave-on treatment. Apply salicylic acid to clean, dry skin. Wait a few minutes for absorption before applying other products. With consistent use over months, you'll see gradual reduction in visible congestion. AHAs like glycolic or lactic acid exfoliate the surface, preventing dead cell buildup that contributes to congestion. Use 5 to 8% concentration 2 to 3 times weekly. You can alternate AHAs and BHAs, or use one consistently based on your skin's response. Don't over-exfoliate hoping for faster results. More is not better. Excessive exfoliation damages your barrier and can actually worsen congestion by triggering more oil production. Stick to 3 to 4 exfoliation sessions per week maximum. Retinoids increase cell turnover, preventing pores from becoming clogged in the first place. Over-the-counter adapalene or prescription tretinoin, used consistently over many months, significantly reduces pore congestion. Start retinoids slowly, 2-3 times per week, and build tolerance. Results appear gradually over 3-6 months. Patience is essential. Cleansing thoroughly but gently prevents new congestion. Use an appropriate cleanser for your skin type. Gel cleansers often work well for congestion-prone skin. Double cleansing in the evening ensures complete removal of sunscreen, makeup, and the day's oil and debris accumulation. Start with an oil-based cleanser to dissolve sunscreen and excess sebum. Then follow with your regular cleanser. However, cleanse only once daily. Over-cleansing triggers more oil production, potentially worsening congestion. Clay masks once or twice weekly help absorb excess oil and draw out pore congestion. Use masks with kaolin or bentonite clay. Apply to congested areas. Leave for 10-15 minutes until dry, rinse, and moisturize. Clay masks provide temporary improvement and support your ongoing exfoliation routine, but they're not a complete solution alone. Oil cleansing or gentle facial oils can paradoxically help congested pores. Certain oils, jojoba, grapeseed, rosehip, can help dissolve hardened sebum and debris in pores. Massage a few drops onto dry skin for several minutes, then rinse or wipe gently. This won't work for everyone, particularly very oily skin, but some people find it helpful for stubborn congestion. Lifestyle factors affect pore congestion significantly. Diet influences oil production and inflammation. Some people find dairy or high glycemic foods worsen their congestion. Consider tracking your diet and skin response to identify potential triggers. Stay hydrated internally. Well-hydrated skin maintains better oil balance and cell turnover. Manage stress, which increases cortisol and oil production. Regular stress management practices help regulate sebum production. Keep everything clean. Pillowcases, phone, makeup tools to prevent reintroducing oil and bacteria to clean skin. Don't expect instant results. This is crucial to understand. Pore congestion develops over time and clears over time. You're essentially training your pores to stay clearer through consistent practices. In the first 2 to 4 weeks, you may see minimal visible change or even some purging as exfoliants bring deeper congestion to the surface. This is normal. Continue your routine. At 6 to 8 weeks with consistent care, you should start noticing improvement. Texture becomes smoother, visible congestion lessens, new congestion forms less frequently. At 3 to 6 months, significant improvement becomes apparent. Your pores look clearer, feel cleaner, and stay clearer with continued maintenance. This timeline requires patience. Don't abandon your routine after 2 weeks because you don't see dramatic change. Pore congestion is a marathon, not a sprint. Take monthly photos to track progress. Day-to-day changes are imperceptible, but monthly comparisons show the gradual clearing. Maintain your routine even after seeing improvement. Pore congestion isn't cured, it's managed. When you stop your exfoliation and care routine, congestion gradually returns. Think of it like brushing teeth. You don't brush for 6 months and then stop because your teeth are clean. You continue brushing to maintain cleanliness. Pore care works the same way. Don't chase every new trend or product. Once you find a routine that's gradually clearing your congestion, stick with it. Constantly changing products prevents you from knowing what actually works. Professional treatments can accelerate results. Regular facials with professional extraction, performed by trained estheticians, help clear stubborn congestion that topical care alone doesn't resolve. Chemical peels provide deeper exfoliation than home products. A series of professional peels can significantly improve congestion. Then home care maintains results. Discuss with a professional whether these treatments would benefit your particular congestion. Adjust your expectations. Even with perfect care, you may always have some visible pores in certain areas, particularly your nose. Completely invisible pores aren't a realistic goal. Clear, healthy pores that aren't packed with visible debris is the achievable, appropriate goal. Remember that genetics play a role. If you have naturally larger pores, they'll remain larger even when clear. This is normal and fine. Healthy function matters more than size. As we close, embrace this truth. Reducing pore congestion is a gradual process requiring consistent exfoliation, proper cleansing, patience, and realistic expectations. There are no overnight solutions, but there are effective long-term strategies. May you develop patience for gradual clearing. May your consistent care yield visible results over time. May your pores become and remain clear. Thank you for this time together. Clear your pores gently, consistently, and patiently.
Silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62. Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59. Acne prevention in acne-prone individuals, true primary prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and high acne since hormonal treatments aren't options. Lifestyle factors, stress management, sleep, diet, are particularly important for males since pharmaceutical hormonal interventions aren't available. Guide 49: Psychological Resilience and Mental Health Integration with Dermatology. Integrating psychological support with medical dermatology treatment often produces superior outcomes, particularly for acne with significant psychological impact. Cognitive behavioral therapy, CBT, for appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology CBT combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and commitment therapy, ACT, helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44. Peptide therapies and bioidentical hormone treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45. Nanotechnology in acne treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and climate adaptation strategies for acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne Success Stories. effective patterns, and realistic timelines for clear skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Diet.
Hello, and welcome to this calm, peaceful space. Take a moment to settle in, breathe deeply, and let any tension in your body soften. Today, we're going to explore one of the most fundamental aspects of skincare, something so essential, yet so often misunderstood: the importance of gentle cleansing. Cleansing is where your skincare journey begins and ends each day. It's the foundation upon which everything else is built. Yet despite its importance, cleansing is frequently done incorrectly, too harshly, too often, or with products that strip rather than cleanse. Let's change that together. First, let's understand what cleansing actually is and what it should accomplish. Cleansing is the process of removing impurities from your skin's surface. These impurities include dirt, environmental pollutants, excess oil, dead skin cells, makeup, and sunscreen. Throughout the day and night, all of these accumulate on your skin, and they need to be removed so your skin can function properly and absorb the beneficial products you apply afterward. But here's the crucial distinction. Cleansing should remove impurities without removing your skin's natural protective elements. Your skin has a delicate moisture barrier, a lipid layer that keeps water in and irritants out. It has a natural pH balance. It has beneficial microorganisms that form your skin's microbiome. Harsh cleansing disrupts all of these, leaving your skin vulnerable, irritated, and imbalanced. Think of your skin barrier like the walls of your home. You want to clean the walls, but you wouldn't use a power washer inside your house. That would damage the walls, strip the paint, and create more problems than it solves. The same principle applies to your skin. Gentle cleansing cleans effectively while preserving the integrity of your skin's protective structures. Let's talk about what gentle cleansing feels like. When you cleanse gently, your skin should feel clean and fresh afterward, but never tight, stripped, or squeaky. That squeaky clean feeling that many people associate with good cleansing is actually a sign of over-cleansing. It means you've removed too much of your skin's natural oils, disrupting your moisture barrier. After proper gentle cleansing, your skin should feel soft, comfortable, and ready to receive moisturizer. There should be no stinging, burning, or excessive redness. Your skin might be slightly pink from the massage and warm water, but it should calm down within a few minutes. Now, let's discuss how to cleanse gently, step by step. Begin with the right water temperature. Many people use water that's far too hot, thinking it will open pores and clean more deeply. But hot water can actually damage your skin's protective barrier, cause broken capillaries, and strip away beneficial oils. Cold water, on the other hand, can be uncomfortable and doesn't allow cleansers to work effectively. The ideal temperature is lukewarm, warm enough to be comfortable and help dissolve oils, but not hot enough to cause damage. When you turn on the water, test it with your hand first. It should feel neutral against your skin, neither hot nor cold. This simple adjustment can make a significant difference in how your skin responds to cleansing. Next, choose a gentle cleanser. Look for products labeled as gentle, hydrating, or pH balanced. Avoid cleansers with harsh sulfates, which are the ingredients that create lots of foam but can also strip your skin. Avoid cleansers with alcohol high on the ingredient list. Avoid anything that feels drying or tight after use. The best cleanser for you is one that removes impurities but leaves your skin feeling comfortable. It might be a creamy cleanser, a gel cleanser, a cleansing oil, or a cleansing milk. The texture matters less than how your skin responds. If you have dry or sensitive skin, you'll likely prefer creamier formulas. If you have oily skin, you might prefer lighter gels. But these are guidelines, not rules. Trust your skin's feedback. When you apply your cleanser, use only a small amount, usually about the size of a nickel or quarter. You don't need a handful of product to cleanse effectively. In fact, using too much can make it harder to rinse completely and may leave residue on your skin. Apply the cleanser to damp skin, not dry skin. Dampen your face first with lukewarm water, then apply your cleanser. This helps the cleanser spread more easily and work more effectively. Now comes the actual cleansing process. Using your fingertips, massage the cleanser onto your skin using gentle circular motions. Don't scrub, don't pull, don't press hard. Just gentle rhythmic circles covering your entire face, your jawline, and down to your neck. Take your time with this massage. Aim for at least 60 seconds, perhaps even 2 minutes. This isn't wasted time, it's essential time. The gentle massage stimulates circulation, helps the cleanser break down impurities, and turns cleansing into a meditative practice. As you massage, breathe slowly and deeply. Feel the tension in your facial muscles release. This is self-care. Pay attention to areas where dirt and oil tend to accumulate, around your nose, your chin, your hairline, and behind your ears. But maintain that same gentle pressure everywhere. No area of your face needs aggressive scrubbing. If you wear makeup or sunscreen, you might benefit from the double cleansing method in the evening. The first cleanse uses an oil-based cleanser or cleansing balm to dissolve these products. The second cleanse uses your regular gentle cleanser to remove any remaining impurities. This two-step process ensures thorough cleansing without requiring harsh products or aggressive scrubbing. After massaging your cleanser for a minute or more, it's time to rinse. This step is just as important as the cleansing itself. Rinse thoroughly with lukewarm water, using your hands to splash water onto your face until every trace of cleanser is gone. Incomplete rinsing can leave residue that clogs pores and irritates skin. Many people rush the rinsing step, but it deserves the same attention and time as the cleansing. Take your time. Make sure your hairline is rinsed. Make sure your jaw and neck are rinsed. Make sure there's no cleanser left around your nose or in the creases beside your nose. Once you're confident all the cleanser is removed, splash your face with cool, not cold water once or twice. This helps close your pores and feels refreshing. Then gently pat your face dry with a clean, soft towel. Pat, don't rub. Rubbing creates unnecessary friction and can irritate your skin, especially when it's damp and vulnerable. Now let's address one of the most common cleansing mistakes: over-cleansing. In our culture, there's often an assumption that more is better, that squeaky clean means truly clean. But with skin, this isn't true. over-cleansing strips your skin of its natural protective oils, which then triggers your skin to produce even more oil to compensate. This creates a vicious cycle. You cleanse harshly because your skin is oily, but the harsh cleansing makes your skin produce more oil, so you cleanse even more harshly. The solution is to cleanse gently and trust the process. When you stop stripping your skin, it stops overproducing oil. It takes time, usually several weeks, for your skin to rebalance, but it will happen if you're patient and consistent with gentle cleansing. Most people only need to truly cleanse once or twice a day. In the morning, many people can simply rinse with water, especially if they have dry or sensitive skin. In the evening, cleanse thoroughly to remove the day's accumulation. If you exercise or sweat during the day, you might cleanse after your workout. But beyond that, additional cleansing is usually unnecessary and potentially harmful. Let's talk about cleansing tools. Washcloths, cleansing brushes, sponges. There are countless tools marketed for facial cleansing. Do you need them?
Tap water or filtered tap water is typically adequate. Unless you have specific water quality concerns, tap water is fine. Some people promote alkaline water for acne, claiming it reduces inflammation. However, your stomach acid immediately neutralizes any pH changes from drinking alkaline water, so drinking alkaline water doesn't meaningfully change your body's pH or skin conditions. Alkaline water claims are largely marketing. Herbal teas and other beverages contribute to hydration alongside water. Coffee and other caffeinated beverages have mild diuretic effects but still contribute to daily hydration. However, excessive caffeine consumption can worsen acne through stress and inflammation, so while counting toward hydration, caffeinated beverages shouldn't dominate your fluid intake. Hydration from food contributes to overall hydration. Fruits and vegetables contain significant water. Eating water-rich foods like watermelon, cucumber, lettuce, and citrus fruits contributes to hydration alongside drinking water. Relationship between hydration and acne typically takes 2 to 4 weeks to manifest. Improving hydration from dehydrated state to properly hydrated state might improve acne noticeably. However, increasing hydration beyond adequate amounts typically doesn't further improve acne. The practical approach: drink enough water to maintain adequate hydration, pale yellow urine, no thirst, distribute intake throughout the day, use lukewarm water for cleansing, and if you have hard or highly chlorinated water concerns, consider filtering. Hydration is one component of comprehensive acne management but not a standalone cure. Guide 36, Gut Health, Microbiome, and Emerging Research on Gut-Skin Axis. Emerging research increasingly implicates gut health and microbiota composition in acne development. Understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: acne only affects teenagers. Fact: adult acne is extremely common and can be more severe and treatment-resistant than teenage acne. Understanding that these myths are false prevents ineffective or harmful behaviors based on misinformation. Guide 77: Acne Treatment Resistance and When to Escalate Care. If acne doesn't improve despite appropriate treatment, several possibilities exist. Understanding why treatments fail helps guide next steps. Noncompliance is the most common reason treatments fail. Using treatments inconsistently, not using them as directed, or expecting results before adequate trial time has elapsed appears as treatment failure. Ensuring 8 to 12 weeks of consistent use before concluding treatment failed is important. Incorrect treatment selection for your acne type causes apparent treatment failure. Using treatments inappropriate for your acne type, for example, using salicylic acid for primarily inflammatory acne when benzoyl peroxide would be better, results in inadequate response. Inadequate treatment strength or frequency might result in insufficient improvement. Increasing frequency or concentration, appropriately, not aggressively, sometimes converts inadequate response to good response. Combination of multiple acne factors not addressed by your current treatment might cause inadequate response. Adding treatments targeting different factors improves outcomes. Underlying conditions, PCOS, other endocrine disorders, infections, causing acne might not be addressed by topical treatments. Seeking professional evaluation for underlying causes is appropriate. Barrier compromise from overuse of strong treatments sometimes appears as treatment failure, constant irritation rather than improvement. Taking a barrier repair break and restarting with gentler approach helps. When to escalate care: if single topical treatments haven't produced adequate improvement after 12 weeks, if your acne is moderate to severe from the start, if you have signs of hormonal acne, if you have deep cystic lesions, if acne is psychologically devastating. Escalating to professional dermatology care, combination treatments, or systemic treatments is appropriate. Professional dermatology can identify why treatments aren't working and recommend appropriate escalation. Don't tolerate inadequate acne improvement indefinitely. Professional help exists. Guide 78: Post-acne skin health maintenance and prevention of future problems. After achieving clear skin, maintaining skin health beyond just preventing acne ensures long-term skin quality and prevents premature aging. Sun protection remains essential post-acne for preventing aging and ensuring any residual hyperpigmentation doesn't worsen. Sunscreen habit established during acne treatment should continue indefinitely. Barrier health maintenance prevents irritation and premature aging. Continuing appropriate moisturizing even post-acne supports barrier function. Regular exfoliation at appropriate frequency maintains skin clarity without overexfoliating. Many people benefit from continuing gentle exfoliation, perhaps reduced frequency from treatment levels, long term. Antioxidant skin care, vitamin C, green tea, others, support skin health beyond acne treatment. These can be incorporated post-acne for anti-aging and general skin health. Retinoids continue providing anti-aging benefits beyond acne treatment. Many people maintain retinoid use specifically for anti-aging rather than acne. Hydration remains important. Maintaining good hydration habits supports skin health long-term. Regular professional skin care, facials, peels, or other treatments, helps maintain skin quality and address any minor concerns before they become problems. Guide 79, Acne Education and Advocacy, Reducing Stigma and Improving Understanding. Acne stigma and misinformation continue affecting people with acne. Education and advocacy help reduce stigma and improve treatment access. Education about acne as a medical condition, not hygiene or lifestyle failure, reduces shame. Educating others about acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management, including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding though others consider it relatively safe. Sulfur-based products, considered relatively safe historically. Most conservative approach during pregnancy, gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety. Postpartum hormonal changes sometimes improve acne that was severe during pregnancy. This improvement can be psychologically significant after months of acne during pregnancy. Planning for pregnancy. If you're on acne medications like isotretinoin requires stopping several months before conception. Discuss with your dermatologist if planning pregnancy. Guide 67, Acne in Adolescence, Age-Specific Management and Developmental Considerations. Adolescent acne requires understanding both the physiological changes driving acne and the psychological sensitivities of adolescence. Age-appropriate management optimizes outcomes and builds healthy skin habits for adulthood. Puberty triggers the hormonal changes driving typical adolescent acne. Androgens surge during puberty, stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next? Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatment's insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68, Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is more sensitive to irritation and barrier compromise than younger skin. Acne treatments tolerated well at 20 might be too irritating at 50. Gentler approaches and more aggressive moisturizing are often necessary. Skin barrier function naturally declines with age, requiring